This is monolithic zirconia, and what we're doing is we are layering porcelain and we're characterizing the gums to give them a lifelike effect. This is one continuous bridge, so we want to give it the appearance that it's individual teeth, but it's all one piece. This is with the gums all on. We're kind of fast forwarding it through. Now, this process is where you're starting to bring the gums and actually the top of the gums in, and to give it a little more of a 3D look. I like to keep the porcelain a little bit more wet. This allows me to mix things together, create a really smooth surface. Just doing the intaglio surface now. Some doctors don't do that inner surface, and I think that's a mistake. And especially where the gums touch, I think it's really important to add that porcelain so it gives a glass finish, which will help the patient keep the bridge from getting food impacted underneath it. On the inner surface, sometimes designers, they try to create so much realness that oftentimes you see the strength of the device be weakened. Okay, now we're starting to prepare to create a shade on the top of the teeth. So we want teeth to look nice and light, but we want to have darker apex is what you're seeing here. They call it a cervical warming. And this gives a lifelike appearance when you have some darkness towards close to the gums. All these teeth are customized depending on the patient's shade of skin, their eyes, the complexion overall, even the color of the lips. All these things come into account when we're shading these teeth. No two bridges would ever be the same. You might start with the base shade that's similar, but then the characterization it goes into what would make it unique and different for each person. Now, the last part here is now to give some translucency on the incisal edge. You can see as you put some blues and some grays on that edge and in between the teeth, it gives it more of a 3D appearance, as if a sun is there's light that's being pushed through there. It's these subtle touches that are so critical, and sometimes it's rushed, especially when you're committing to a case to be completely finished in 24 hours. I think this is where you can rush the case and maybe move a little too fast. I like to see what it looks like in the mouth before the patient is thinking they're going to take it home so that I can adjust it. Because as I'm doing this, I'm looking at pictures. I'm looking at the pictures of the patient's original teeth. I'm looking at their temps. But then we put it in the mouth and we look at it, and this is where I have a chance to see if the shades worked out the way that I thought they should. So from this step here, it goes into an oven and it bakes at a really high temperature, and what you see that's wet here becomes hard. And then oftentimes we'll do this process 2 or 3 times. Each of the steps that I did, with the gums and then the shades of the teeth and the warming, you could do those as individual bakes instead of doing all at once. Here I'm just trying to show the doctors that it can be done all at once.